healthcare. And so when you don't have a resource hub like Outcare or other great organizations out there doing amazing work, you can feel pretty lonely, especially in a lot of rural communities where there
Yeah.
is no community center that you can go to and find community or care or services. And there is no, provider near you that you might be able to tap into. And it can be very scary and daunting to approach the healthcare landscape as it is today for queer people.
I imagine so. It is, yeah, the whole healthcare experience is already a challenge, especially for so many minorities groups, and I imagine for the whole LGBT community, it's not easy. And how do how do healthcare organizations partner with the Outcare Health and physicians find out about you? Do you? I understand that you are informational hub, so
Yeah.
how do you reach out to them?
Yeah, so thankfully, the organization has many amazing partners, providers, clients, volunteers who all make the work possible. So a lot of it has been, as it was before, word of mouth, or at least, now with the help of a lot of technology.
Of the Outcare Health. Welcome, Christopher.
Yeah, thank you
So
so much for me.
yeah, thanks so much for accepting my invitation. I'm really happy to have you. So can you tell us a little bit about yourself and what you do?
Yeah, absolutely. So as you said, my name is Chris Roman. I'm executive director of Outcare Health. I feel like that looks and feels like many different things depending on the day, but I've been with the organization since 2018. I
Mhm.
call myself the jack of all trades because I do a little bit of everything with working with some of our providers, our partners and clients, as well as our volunteers, which I like to call our boots on the grounds that really help us spread and raise awareness about the work that we're doing in LGBTQ plus health.
That's awesome. And can you share a little bit about the Outcare Health, this working mission, and how did it start? Did it start in 2018 when you joined it, or was
Yeah,
it
so
around?
Outcare Health was actually founded in 2015, and Outcare Health is a 501c3 LGBTQ plus health equity organization. And over the years, we have done many different iterations of our programs, but we do have a bread and butter per se of what we do, which really circulates around our main program, which is called the Outlist, and it's an
Mhm.
LGBTQ plus affirming provider directory, and it's one of the largest directories of affirming providers in the nation, but it's also an international directory with representation in about 13 different countries, large portion of those being in the US and Canada. But it's really amazing to see how folks are responding and joining in on our mission and cause. Outcare was started initially by Dr. Dustin Nowaski in medical school back in 2015 at
Mhm.
IU School of Medicine, and they were going through some of their courses and interacting with providers and institutions, and kind of realized that lack of education and gaps in education when it came to LGBTQ plus training and curriculum. And so, as a queer person, it really got them thinking. Why is there a gap? What can be done, and how they could develop programming and initiatives that would support providers and even educate patients on how best to find affirming care or what affirming care looks like. At the same time, there was all this discussion of, where do I go for LGBTQ plus health specific resources and providers, and no real central location to find that information. At the same time, that training and education piece that I mentioned earlier, and lack of education, where do we go for that? And so, really, that was the birth of Outcare, where we now focus on directing people to providers who practice affirming care via the Outlist. We have our community database that has over 700 LGBTQ plus healthcare resources identified across the US, while we also pump out training and education courses that medical students and providers can take to better inform themselves on the unique needs of LGBTQ plus communities, which we don't see often is happening in a lot of medical education programs, or even, once you're a provider and have been practicing for years, re-upping and staying up to
Yeah.
date on your education. And so that's what we're about. We have a lot of free programs and initiatives, consultation services, mentorship programs, support groups, we do research in house to inform our decisions and really think about where do we go next in order to fill in the gaps that we see in our healthcare system. And we're really proud of the work that we're doing so far to support our communities.
That's awesome. Yeah, like we had a conversation before we started. It was really, when I found out, learning about Outcare Health, I was really impressed with the work that you do and how, because we see that like with the LGBT friends and people that I know, that it's like that's one of the struggles, right? To find a provider that it's friendly, that really understand their needs. And so many times it's like people are asking around, hey, what is that referral? And I think that it's really neat how Outcare puts that platform here. Now that's our place. So like you can find, you don't need to jump so many hoops, right? And so many bad healthcare experience. And you help them, right, to find the right providers for them, the right experience.
Correct. And we don't offer our own direct care services. So we're more so an information hub for the community at a time where, we see record-breaking anti-LGBTQ plus legislation targeting all walks of life in our community, but most importantly, healthcare. And so when you don't have a resource hub like Outcare or other great organizations out there doing amazing work, you can feel pretty lonely, especially in a lot of rural communities where there is no community center that you can go to and find community or care or services. And there is no, provider near you that you might be able to tap into. And it can be very scary and daunting to approach the healthcare landscape as it is today for queer people.
I imagine so. It's the whole healthcare experience is already a challenge, especially for so many minorities groups. And I imagine for the whole LGBT community, it's not easy. But like, how do healthcare organizations partner with the Outcare Health and physicians find out about you? Like, do you? I understand that you are informational probably. So like, how do you reach out to them?
Yeah, so thankfully, the organization has many amazing partners, providers, clients, volunteers who all make the work possible. So a lot of it has been, as it was before, word of mouth, or at least, now with the help of a lot of technology, being able to type in keywords on Google and other sources to find our site organically. So we often see a lot of traffic on that front, but there's a lot of word of mouth between providers saying, hey, I'm on this list. I practice affirming care. This is how I do it. I know you do as well. You should be on this list. At the same time, tapping into your network and the folks that you work closely with, saying, hey, I know that maybe this isn't your focus and your specialty necessarily, or how you go about your care, but here's some education and training if you do want to get into that space. And so we see a lot of that natural referral paths between providers, but then also our partners and our collaborators and clients often will share our resources to their audiences. And then it just keeps, skyrocketing from there in terms of people finding out who we are. And so it's been wonderful to see it grow, especially since 2015. And even when I joined the organization in 2018, with almost last year, I think alone, 1 million people coming through the site looking for care services. And it's just, you think with the healthcare system that there wouldn't be gaps at this moment in order to find care, but it's very real, and it's very real for our community.
That's all, like the whole 1 million people, and so, and you needed that too, right? You needed that word spread out more for people. And in your experience, what are some of the main barriers Outcare Health still faces in expanding the access of healthcare services to the LGBT community?
Yeah, I love this question because often, folks think that there's just one, swoop, wave of the wand that can really solve the issues that our community is facing in healthcare, or that the healthcare system is facing. But honestly, there's really many different barriers that are intersecting often to create the system that we see today. I think the most important for the queer community is stigma and discrimination. According to studies at this moment, over 50% of LGBTQ plus communities, especially our gender diverse communities, have experienced some sort of discrimination or denial when it comes to the healthcare setting. And that's really disheartening to hear,
Mhm.
but it's a reality that our community faces every day when they're deciding to go to the doctor. And often they will delay care. And studies show that in the last year, over 50% of LGBTQ plus communities have skipped or delayed care out of fear of stigma and discrimination in the healthcare setting. And overall, there's a lack of trust when it comes to providers and the health system, health plans, pharma, when it comes to this community in particular. One stat, according to one of our recent studies, almost 85% of LGBTQ plus people don't trust their healthcare provider. And that's honestly shocking, but
Yeah.
given the way things are at the moment, it's the leading reason why it's so hard to get folks to the doctor. And this leads to prolonged health conditions, suicidality, um, um, depression, anxiety. And a lot of folks in the healthcare space are like, "Well, come to the doctor." But if the space is not welcoming and affirming to who you are and your identity, it's really hard to just go out and do that. That's the leading issue we see. But
Mhm.
I will also say it's the system itself where there is a lack of, affirmation training, cultural competency training, um, humility training. There's many different terms for different types of trainings out there, but really trying to understand the person as more than just a 2-minute visit, but an actual person that's coming
Yeah.
to you in need, and thinking about the unique intersections in their lives that has led them to this point and that visit, and how that might be playing into their health and their well-being. And really understanding the unique needs that LGBTQ plus communities face from different, parts of society or systematic issues we face in society that causes more needs at the moment for the community. And while we would love for training to be the only solution or one of the solutions, we often see that it's not happening either in medical education or within healthcare settings that providers are practicing, that there is no training and education to really help them better understand different community needs, especially for queer people. And that leads right into policy and systemic barriers, whether it be anti-discrimination policies, um, records, electronic health records, intaking data like SOGI data, insurance coverage, and that thinking about how those cover specific services and procedures for the
Mhm.
community. Often the queer community being denied outright the services that they're looking for. So there's a lot of compounding factors here, including where you are, geographically, rural or city, and the access to providers with knowledge and skill when it comes to this community's needs. There's a lack of data and research to really understand those unique needs and how we can address them appropriately. There's financial risk and barriers here for this community in
Yeah.
particular that often reports, higher unemployment or are more likely to be uninsured. And then think about the intersectional barriers, all these compounding all together. Say you're queer and a Black woman, and you also have a disability, and how that intersects with who you are today and the healthcare services that you're seeking. So there's a lot of different things that really make it difficult for
Mhm.
queer people to access healthcare today. And we really need to be working together to address these things all together.
Yeah, it's yeah. Like I said, I guess all the socioeconomics, right? And it's like to look at the healthcare system, and it's really look more the patient is as a whole. Like I said, it's not just as a number. And like you said, you look at it as a whole in everything. And it's sometimes it's like at the queer identity, the lesbian, it's just one piece of your whole identity, right? And then if you like you put, if you are Black, if you are Latino, and if you have a disability, just to compound the challenges, right, that this patient is facing.
Yeah, absolutely.
Yeah, and you just how can we as a society like combat, like I said, the whole stigma, right? The whole education and the policy, the political, the policy side too, right? It's not just, like you said, it's not just one factor. It's just the healthcare, it's one piece, and the healthcare in itself, it's not just the patient, doctors, or the health system. Like I said, there is a whole larger system. And how, that's all that's the question, right? How different is the experience of the LGBT patient across the different states, right? Why your likelihood to find a friendly, LGBT friendly provider. And what are some of the main resources that Outcare Health offers to patients, provides to patients?
Yeah, so based on, some of the issues that I just mentioned and the barriers right now that exist within healthcare, but also our community, Outcare tries our best to bridge those gaps, right? And create this information hub where some of this might be not necessarily solved, right? Well, I would love to solve all the issues in our systems, but at least can make it easier for providers and patients to access information that it is not always readily available. And so the Atlas is our main, bread and butter that really supports patients where they are. So patients can visit outcarehealth.org/Atlas and search by specialty, search by keyword, or even search by individual providers that they might have heard about from another friend, provider, family member, you name it. And really putting it all into one central location so that way you can see the different types of services that you can tap into within your community and near you by the search of zip code or state. It's really life-changing. We
awesome.
often get people who are reaching out to us and need a bit more of assistance. So we'll even help those individuals via care navigation. And we have staff in-house who will point them in the right direction so they can actually speak to a person. And that's not always super common, right? In terms of when you're initially starting that phase of looking for a provider. But it's even more so for this community where that knowledge, again, on affirming care and affirming providers and the practices is not always readily available. And so the Atlas is a great resource for patients, but it's also a great resource for providers. So that way they can attract more patients into their practice. And so it's a pretty good cycle right there where providers can bring in more patients that they want to see and care most about and want to have an impact, but also patients can make sure that they have peace of mind knowing that they're going to a provider who at least has some base knowledge. And if you don't have base knowledge, Outcare also has resources where you can take on-demand training, virtual training. We'll often work with different corporate organizations, healthcare systems, payers to come in and do virtual or hybrid trainings to really support increasing knowledge, skills, strategies, and overall attitudes when it comes to caring for this population. And so those are some of our main resources. But outside of that, I mentioned earlier that we have support groups that happen quarterly. We have a mentorship program so that patients or community members can connect with like-minded mentors. That's often a gap that we see, not having any leaders to look up to guide us through some of the things that we're experiencing in life or in work or as an individual. And so those mentors are there as a support system. We also often will do some consultative work with different organizations to help them do better and and put their best foot when it comes to supporting the community. So we often will come in and say, where are you now? Where do you want to be when it comes to LGBTQ plus health and equity? And how do our services fill in the gaps? And often, a lot of groups will come to us or ERGs will come to us not knowing where to start. And we are that starting point for them. And so we've been really proud as an organization to be supporting a slow change, but a very important shift within the healthcare system.
That's awesome. Yeah, like I said, it is. I think especially, I guess, for the providers too, right? For the provider, if they want to start to educate themselves and really promote health equity, not just talk about it, have it as a statement their mission, but actually live that. Okay, how can I put that real in practice, and how can I be inclusive and help me provide a real inclusive care to to my patients is, like I said, because so many of the doctors today didn't have this education, right? During medical school. And then there are probably so many other doctors today that are going through medical school, or students are not completely aware about this resource. So that's awesome that you provide this support for our healthcare providers.
And most importantly, in terms of some of the resources that we provide, I think community, adding that in, we are this information hub, but we've created a network of providers, patients, and collaborators who we're often tapping into and saying, hey, we have this issue or topic that we need answered. We're definitely, queer people with lived experience and often working in the healthcare space, but in no way is anyone always going to be 100% an expert. And so working and collaborating together with different individuals in different spaces is really how we get to, an answer or solution of how to best proceed. And so it's been really great. We've been really happy to call it the Outcare family, because often, we can email some of these providers and say, hey, we have a patient who needs this or has a question about this, or, hey, we're having a webinar and we would like you to speak on, gender affirming surgeries, hormone therapy for this specific client or audience, or for patients, connecting them to support groups and other resources out there near them that might be beneficial. So it does feel tight niche, and we're really happy to be that source of information for both providers and patients.
Yeah, my next question probably like is going to tie with everything before. Yeah. Like, okay, so in your opinion, so how can healthcare leaders and the healthcare providers best prioritize the health equity for the LGBT community?
Yeah, this is my second favorite question that we often get, but again, it's a multifaceted approach for this as well. But I think it will always lead with education and training, right? There is a knowledge gap for a lot of providers and even patients, but specifically for healthcare providers and health systems, where they don't know where to start. They've never experienced or claim they've never experienced treating LGBTQ plus people, which I think is impossible, statistically impossible.
Yeah, exactly.
But, maybe it's the fact that a patient didn't feel comfortable revealing the fact that they were a member of the community to you as a provider. What did you do that made them feel that way? Who knows? But, I think it starts with education and training so that you can recognize how to create safe and affirming environments for patients to come in and be their most authentic self. When I talked earlier about medical schools and providers taking on training, there's been studies, including studies that we've released in publications by our founder and president, Dr. Nowosky, that says providers and medical students need up to or over 35 hours of LGBTQ plus informed education in order to feel prepared to care for LGBTQ plus communities. Now that's a lot, but what we actually see in terms of other studies, one study in particular in 2011 showed that it was just 5 hours of LGBTQ plus related training and content within a specific amount of medical education schools. And they've updated that since 2022 and did a long data set to find that now in 2022, it's gone up to 11 hours, which is great. We love to see it increase. It's still not nearly enough to get to the point of 35 hours that is needed, but also the recommendations outlined by the Association of American Medical Colleges and other leading organizations out there that have been pushing for additional education and training. And that's the biggest piece. I think that goes a long way and can really help people feel prepared in terms of the knowledge and the skills or even strategies on how best to communicate with patients, create a welcoming environment, refer folks out if, in the moment you don't feel like you have enough knowledge and skills, which is okay too. I think coming together, whether you have private practice or a health system, hospital, you name it, larger healthcare IT tech companies, thinking about your policies and practices that create those welcoming environments, right? Making sure that you have non-discrimination policies on the book when it comes to sexual orientation, gender identity, and thinking about how that then fits into your forms and your actual procedures in the healthcare setting. Going beyond binary gender options on your intake forms and making sure that you're intaking overall just SOGI data into electronic health records.
Yeah, it's how you communicate, right? I work a lot in the whole community, especially healthcare communication, and that's it. That's start with the inclusive language, right? And inclusive communication. How, like I
Yeah.
said, it's already a challenge for with the small amount I think that physicians have with their patients. It's already a challenge to build the trust with the patient, and I think like when you have communicate in a language that inclusive language, you are just going to help it to explain to I think that trust that the patient is looking for too.
Right. And ultimately, creating a welcoming environment starts the moment that a patient enters, the office or the space that they're seeking healthcare. And so trying to be visibly supportive as well. So whether it be safe zone stickers, a pride flag, or posting up what your anti-discrimination policies are, saying things like, all are welcome here, things like that, inclusive language when folks are coming in, using pronouns. Those are things that you can easily do to create an affirmative environment for people. Now I realize that those are more simple things that folks can do, but we can get more nitty gritty, right? Thinking about
Yeah.
access to care, telehealth, and making healthcare overall more affordable, inclusive for communities. Because right now, there again, we have insurance companies denying specific care services for LGBTQ plus communities, or outright, denying care overall because they don't want to treat a trans individual or someone who is gay. And so there are a lot of compounding issues there, but thinking about how we create support and resources for this community specifically is going to be very vital, or even referring out, in the community, if you happen to see a patient who is of the community and is struggling, um, point them to a peer support program near you, or think about how you can tap into community partners who might have programming that can better support LGBTQ plus communities in a way that you at the moment can't.
Yeah.
And I think thinking more, again, back to that whole person approach in healthcare is what we need to aim for, while also, leading the charge and advocating as much as we can for those policy changes, those procedure changes, encouraging LGBTQ plus people at the local level, state level, national level to, take their seat at the table, right? So that
Yeah.
way their voice is heard in these discussions about what healthcare should be and what healthcare should look like. I think there is also a lack of research and just data collection overall. And so we have these big issues, and then we usually point to research. How do we solve this? But there's not enough data being collected for us to create tangible solutions to address these disparities. And so the moment that we start combining all these things together to
Yeah.
really
It's a whole
think,
system issue, right? That we need to expand into to the level of the whole system.
yeah, exactly. And it's not easy.
No,
Work,
no, 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 it's not. And I think like yeah, you need to start. You need to start somewhere, right? And then, like with small steps, and yeah, and like I said, I think in different types of healthcare organizations and policies. But I was thinking like I need to look into in studies, but I was looking like some studies related to disparities even in recruiting Black patients for clinical trials, because there is already some distrust there. And then like, okay, how much are we looking at in terms of the LGBT plus community, in terms of the drug or clinical trials, looking for drugs for procedures? How are you going to benefit this community if these organizations, they are not bringing them to the table, right? In participating in studies, in clinical trials, in the development of drugs, of medications,
yeah, yeah.
treatments, correct?
And historically, LGBTQ plus people, Black folks, Latinx folks, Asian communities, we've been left out, right, of
Yeah.
those studies and those research studies. And now we're at this pivotal point where it's like, okay, how do we address the issues? Well, we got to first start by making sure we do have our seat in all different areas, so that way we can better address some of these disparities.
Yeah. What is the biggest takeaway you hope like the listeners from this podcast? Yes.
Yeah,
Can learn.
I always think that the biggest takeaway is educate yourself. If you are listening to this and any of the things that I talked about or that you talked about, you're like, I don't know anything about that. Well, you as a healthcare provider or even a health professional in your space should know about the issues that LGBTQ plus communities face, and beyond that, what BIPOC communities face. And it all starts with just taking the moment and time to educate yourself, whether that be articles online, training and education courses you might find online, talking directly with folks in the community, you name it. It really starts with you taking the steps to, gain that knowledge and that skill, and then you can keep on being an agent for change, excuse me, and speaking with other people in the community. So that way, collectively, we're doing better.
So yeah, be an agent for change, like it spread the word, right? And I think like it is a great that work that Outcare Health is doing. It's a great resource for everyone. I think like it's so many of us, we have friends start in the LGBT community or have family members, all that, and then you can share that, spread this word. I'll definitely be sharing more about that because so many times people don't know about it, and then it's like you may not know directly a doctor, you may not know, may not have all the answers, right? But like, hey, I know this platform here. They have experts, they have people that's going to help you to connect where you need it to be.
Yeah, absolutely. And sometimes you never know till you ask the question, right? Or till you do more to learn more. And so it just initially sometimes takes some steps from you as an individual in order to begin thinking about how you can care for different communities in a different way that meets their needs.
Exactly. Yeah. If you really want to, I think if you really, in everything in healthcare, right? If you really want to see real change, it takes all of us. It's not just like, hey, all these disparities that the LGBT community face, that the Black community face, the Latino community face. Let's take care. They worry about, and it's like we will not help. It's like all the problems of the disparities, of the bad experience and the bad health outcomes that minority community have to affect all of us. We pay all the burden, the cost of that. So it takes all of us to make changes happen.
Exactly. Yeah. And outside of, educating yourself, I would say, if you're a healthcare provider and you do practice affirming care, definitely come and visit Outcare Health, and you can join the out list for free. And put yourself in front of the million plus LGBTQ plus people that have come to our site, and I know that will increase over time. You can find more information at outcarehealth.org, and I hope that you'll just take the time to better understand what issues the community is facing and think about the practices that you can implement within your own practice or elsewhere to better serve the community overall.
Thanks so much, Chris, for joining us. And I'll be sharing your website, all the resources for people. Awesome. Yeah. Thanks so much for coming.
Yeah, thanks so much for inviting us. And it's been a pleasure to talk on this. I get really, excited to talk all about issues like this and really spread the word. So we appreciate you giving us the mic.
Yeah, that's awesome. I love that. I love to connect and to help you, to be an agent for changing.